Hi, I'm Justin Gill. I'm an urgent care nurse practitioner living in Everett, Washington, and I'm speaking out right now because right now healthcare is under attack. Patients that I care for every single day, the programs that they care about, like Medicare, Medicaid, the Affordable Care Act, this ability to access a healthcare provider, all of that is under threat right now. We are in a time right now where our healthcare system, our healthcare providers do not get support that they need from the federal administration. When it comes to looking at gutting programs like Medicaid, attacking programs like Medicare or the Affordable Care Act, or the ability to access insurance, that not only limits access for patients, it makes my job a lot harder as a healthcare provider. When I see patients, sometimes I need to order diagnostic tests, order screenings, order imaging. And part of the issue is if patients can't afford it, that's going to directly impact their outcomes and the success of their care plan. For me as a healthcare worker, I also rely on accurate science and data. When we see activities like canceling or delaying the advisory committee on immunization practices committee meetings, or we look at disinformation or misinformation or questioning science, when we look at cutting the CDC workforce of disease investigators, those will all have ripple effects on my ability to do my job. Just 2 weeks, I was on the CDC, 2 or 3 weeks ago, I was on the CDC website looking at guidelines for sexually transmitted infections, and I couldn't even find some basic information on the website. As a taxpayer and a healthcare worker, I think that we all should demand accurate and accessible information on our federal agency websites. Healthcare is something that affects everybody, whether you live in an urban area like Seattle or a rural area of the state. We all need healthcare at some point in our lives, and it's time that we get this administration to take the politics out of it, to take the ideology out of it, and focus on actually providing care to patients and listening to us that work on the front line and see these patients and are accountable for the decisions that we make. The question here is this administration going to be accountable for the decisions that they make? Or are they going to let us have to deal with the consequences and have patients have poorer outcomes while they ignore us when things go bad? That's the question here. And I call on the administration, just as a Washingtonian and a healthcare provider, to stay out of science based institutions, take out interference in some of these agencies that provide vital services for patients and communities, and really focus on what is it that we need to do to be able to care for patients in a way that's going to improve their outcomes and help support us on the front line. I shared my story today about what the impacts of this administration will have on my ability to do my job and the care that my patients receive. I'd encourage all of you to share your stories and speak up for not just your patients, but your communities and your loved ones.